Scenario given is you are on your morning rounds where you notice your colleague behaves unusual with inappropriate conversation, has impaired coordination with smell of alcohol, and he or she is actively reviewing patient and writing orders in the patient's file. So first of all, the first question is, how do you handle the situation in accordance to medical code of professional conduct? So there are few codes of conduct. For example, the first code of conduct is doctors must make the care of the patient as their first concern. So they should assure that the colleague stop seeing patients and writing orders, and they should have so need to check that the clinical decision that has been already made is correct or incorrect to prevent any potential harm. And also the code of conduct requires that unsafe and also impaired practice to be reported to protect the patients, and do not speculate or accuse your colleague unnecessarily. And also the conduct requires that your colleague to be treated with respect and protect their confidentiality. Do not discuss the incident that has already occurred with other staffs. And also you should support your colleague who may be unwell, or to know what is going on with your colleague. Okay, and the second question is, how would you balance your duty to protect the patient's safety, maintain professional integrity, and to support your colleague? So how I would first, I would like to prioritize the patient's safety. First, I will find a way to remove my colleague from any clinical duties immediately but sensitively. Like, for example, I would like to tell them that I would like to speak to you privately for a moment and suggest them to take a break. And to prevent further harm, don't let your colleague to continue reviewing patient and writing orders. And also, secondly, I will inform to my senior specialist or consultant or registrar on call on that day regarding the incident that's already occurred. And also, I will document it objectively, record what I have already observed factually without any judgment, and the documentation regarding your colleague should be private and also confidential. And also, you should support your colleague professionally, avoid any confrontation or blame at the moment. You must ensure that the safety of the colleague, and also make sure that your colleague gets help lah, not punishment instead. And also, you can encourage them to seek any support, for example, any support group, or maybe seek advice from your superior or any occupational health services. And also, you can finally follow up with your senior to ensure that your colleagues get supported appropriately and proper action has been taken. And also, thirdly is like, what steps that you would do immediately, and how do you approach the issue in a longer term? So has already been mentioned just now, the steps that I would take immediately is that I will prioritize my patient safety by removing my colleague from the clinical duties, inform to my superior, and document what has already happened objectively, and support my colleague professionally, and make sure that appropriate action has been taken. And for long-term approach, I will support my colleague by referring them to any support group, and make sure that we recognize the impairment that have already occurred. Maybe, for example, my colleague is under stress or burnout or having any addiction or any health mental illness. Support them with compassion, and also make sure that proper reporting have already been done. For example, like any proper documentation, hospital incident reporting system, and also, if necessary, we can report to the medical board if it is in line with the duty to protect the public health. And also, finally, I would like to reflect, debrief, and also ensure that my own well-being is being supported. And also, in a team, we would reflect how to create a safe space or supportive culture that identifies or addresses this kind of impairment earlier, and also understands the institutional and also the ethical guidelines. And fourth, final question is, what ethical principle guides your action, and what are the challenges that might arise in addressing these kind of sensitive issues? So the ethical principles that been implied in this scenario is, first, beneficent. Beneficent, first, we act in the best interest of the patient. We should ensure the patients receive safe and appropriate care. Second is non-maleficent. Do no harm, meaning you prevent any unsafe care by removing your impaired colleagues. Third is autonomy, where you respect other people's dignity and decision making. For example, you respect your colleagues' dignity by acting, but if in case it endangers, you should act against the autonomy of others. And fourthly is the justice. So you should give fair treatment and accountability. You should ensure that it's a safe and also fair care to the patients, and also fair treatment for your colleagues as well, by balancing the accountability with patient and assess support group to your colleague. And finally, professional integrity, where you act with honesty and also integrity yourself. And also, what are the challenges that I addressed while attending to this sensitive issue is, first is emotional discomfort, where first you yourself have to stay professional, act calmly and with empathy. And sometimes it can be uncomfortable, where you confront your colleague, who is especially your best friend or a peer, and you may worry about damaging your own professional relationship with them, and can be perceived as disloyal lah when you complain this kind of sensitive issues. Secondly is the fear of harm to your colleague. So by this reporting this can lead to disciplinary action to your colleague, and can impair their career. So the concern is that they might be struggling from, for example, any burnouts or any mental illnesses or any stress or substance use disorder, that they might need help lah, rather than punishment. And finally is like sometimes can cause us to have some uncertainty of judgment. For example, I might question myself whether my observation is sufficient enough to report or to act. Maybe my the risk of underacting because of the fear, or maybe I could be wrong, or sometimes I could be overreacting to the scenario that might happen. So this is but it based on the objective observation that I see, not on assumption. And finally, the challenge is that it can risk my own self, where I might be involved in a formal investigation, and I worry that I can be labelled as a troublemaker, or dealing with backslash from my team members lah, by reporting this sensitive issue. Yeah, but at the end, I'm helping first the patients as well as my colleague for the betterment of the public service. And remember that always when you speak up, the medical board will protect us. Yeah, thank you.